Welcome to Satu Caryu Online Nursing Channel. I am Satish Rajamani. In this video, we are going to see 21 questions of AIIMS staff nurse exam in the previous years. So here I am going to discuss you the answer for those 21 questions. Let's go for the first question of the day. Deficiency of which of the following vitamin during pregnancy may cause neural tube defect? Folic acid, riboflavin, niacin, thiamine. So any guess? The right answer is folic acid. Folic acid deficiency can cause neural tube defect for the newborn baby. Question number 2. Which one of the following blood group is an universal recipient? A, B, AB and O. The universal recipient is AB. Those person with AB blood group can receive blood from other blood group members. Question number 3. Which one of the following is the most common side effect of aspirin? A. Gastrointestinal bleeding. B. Constipation. C. Nystagmus. 3. Urinary incontinence. Aspirin causes major side effect like gastrointestinal bleeding. Question number 4. The first drug of choice for a patient admitted with status epilepticus is option A phenytoin, B carbamazepine, C diazepam, D sodium valproate. The drug of choice for patient with status epilepticus. The right answer is diazepam. Question number 5. Which of the following part of eye contain rhodopsin pigment? Rhodopsin pigment is present in which of the following part of eyes? Rods, cones, lens, iris. Rhodopsin or so easily you can keep in mind rod. Rods contain the rhodopsin pigment. Next question. The lung function test are determined by option A tonometer, B spirometer, C sphygmomanometer, D barometer. The right answer for this question is spirometer. Spirometry. Spirometry is the process. Spirometer is the device used to check the function of lungs. Question number 7. The agent contraindicated with warfarin treatment is aspirin, ranitidine, codeine, ispagal. The agent contraindicated to administer along with warfarin is aspirin. Aspirin can induce bleeding. That's why we cannot give with warfarin. Question number 8. How a nurse will teach breathing exercise for a patient with chronic bronchitis? By using pursed lip breathing, use chest breathing, use open mouth breathing, use deep inhalation breathing. So for chronic bronchitis patient, we should teach the patient to use pursed lip breathing. Exercise must be taught for the patient. And question number 9. Which guidelines a nurse has to follow when caring for pressure sore? Option A. Wound must remain moist. Tight picking of the wound. Option C. Dressing to dry before removal. Option D. Plastic sheet type of dressing for cover. So the answer is fourth one. Plastic sheet type of dressing for covering of the wound should be done. Question number 10. When a post-operative patient develops evisceration, what a nurse should do? Option A. Provides moral support. Option B. Ask patient to drink more water. Option C. Push the protruding organs inside. Option D. Cover the protruding organs. So evisceration time, the nurse must cover the protruding organs with moist cloth. So the answer is D. Question number 11. The nurse is caring for a client with heart failure. On assessment, The nurse notes that client is dyspneic and crackles are audible on auscultation. What additional signs would the nurse expect to the patient in the client if excess fluid volume is present? Option A, weight loss. Option B, flat neck and hand veins. C, increased blood pressure. D, decreased central venous pressure. So in this case, the patient can have increase in blood pressure. So when there is excess amount of water on assessment, nurse notes that client is difficulty in breathing is there and crackles are audible. The nurse can come to a conclusion that increase in BP is common, most common, because the excess of fluid volume is present in the heart failure patient. Question number 12. The nurse is preparing to care for a client with potassium deficit. The nurse reviews the client record and determines that client was at risk of developing the potassium deficit because of which situation. Potassium deficit occurs in which situation? Option A, sustained tissue damage. Option B, requires nasogastric suction. Classic history of addition disease is taking potassium retaining diuretics. So in this question, the nurse is preparing for care nurse is preparing to care for client with potassium deficit. So potassium deficit usually occur when you suction the gastric contents. So the right answer is the client who requires nasogastric suction is prone to develop potassium deficit. Question number 13. The nurse is performing an assessment on a client who has returned from the dialysis unit following hemodialysis. The client is complaining of headache and nausea and extremely restless. Which of the following is the most appropriate nursing action? Option A, monitor the client. B, notify the physician. C, elevate the head of the bed. And D, medicate the client for nausea. So in this, the nurse must immediately notify the physician when the patient comes from dialysis unit. If they complain of headache and nausea and restlessness, the nurse should notify the physician immediately. Question number 14. The nurse is monitoring a client for the early signs and symptoms of dumping syndrome. Which of the following indicate the occurrence? Sweating and pallor, bradycardia and indigestion, double vision and chest pain, abdominal cramping and pain. The right answer, the initial symptom seen in the dumping syndrome patient is excessive sweating and skin gets pallor. Question number 15. A patient who is administered medication sublingually, what we should do? It has upper GI problem, should ingest food or liquid to help absorption of the medication, shouldn't eat or drink until the medication is absorbed. D, none of the above. So here the patient is given sublingual medication. So after administering sublingual medication, the patient shouldn't eat or drink until the medication gets absorbed. Next question. If the dose of a transdermal patch is more than the prescriber's medication order, what you should do? Cut the patch to an appropriate length, contact the prescriber, do nothing, give the patient the patch anyway. So the right answer here is contact the prescriber. Understood? So when the dose of the transdermal patch prescribed by a physician is going to be higher, so don't administer, just contact the physician who prescribed this patch. Track injection is used for what? To prevent medication from leaking back onto the tissue, to prevent dislodging the needle, to ease the pain of the injection, and none of the above. So usually track injection method Z-track is usually given to prevent medication from leaking back into the tissue. This is the primary reason why you give Z-track injections. Question number 18. The following can be used to treat hypothyroid except, so the which drug cannot be used to treat hypothyroidism? Option A, thyroid USP, also known as Armour thyroid, Liotrex, known as Thyrola, Leothyroxine, commonly known as Cytomen, and Methimazole. It is a tapazole. So the commonly used drug which is not used in hypothyroidism patient is Methimazole. So your answer is here, methimazole. Why? Methimazole usually reduce the thyroid secretion that we cannot give for hypothyroidism patient. Question number 19. An adult female client has a hemoglobin level of 10.8 gram per deciliter. The nurse interprets that this result is most likely caused by which condition noted in the client's history? Option A, dehydration, B, iron deficiency anemia, C, heart failure, D, COPD. So which condition leads to the decreased hemoglobin level in the female client? So if you see, iron deficiency anemia is the most common cause. Question number 20. The nurse is developing a plan of care for the client with multiple myeloma and includes which priority intervention in the plan? So myeloma patient, for us a nurse, what primary intervention we should give? Option A, encouraging fluids. Option B, providing frequent oral care. Option C, coughing and deep breathing. Option D, monitoring the red blood cell count. So the right option for myeloma patient is encouraging fluids. Why? The patient suffering from myeloma will have hypercalcemia. Hypercalcemia increase cause many complications. So we need to keep the patient hydrated. So encourage fluids for the patients. And question number 21. The client is diagnosed with stage 1 Lyme disease. The nurse assesses the client for which characteristics of this stage? Option A, arthralgia, B, flu-like symptoms, C, enlarged and inflamed joints, and D, signs of neurological disorder. So in this case, initial symptoms like lesions, apart from lesions, flu-like symptoms are most common in stage 1 of Lyme's disease. So this is the right answer. So we come to the end of today's lecture. Hope you enjoyed today's lecture. You learned 21 questions and you can score 21 out of 20 in your exam in future. Thank you for watching this video, and if you have any doubt, you can comment in the box below, and I like you all to subscribe my online nursing channel Satu Care You. Hope to see you in another video very soon. Bye bye, take care.